Hi, I'm Dr. Jyoti Patel. Today's topic is irritable bowel syndrome and the low FODMAP diet. So what is irritable bowel syndrome? It's when patients have had their full workup and they know they don't have anything more serious going on, but they have symptoms of gas, bloating, indigestion, cramping, abdominal pain, followed by diarrhea or constipation. Their symptoms may be relieved by having a bowel movement, or they might have problems with frequency, whether it's not enough or too many, or the stool consistency. So when patients have irritable bowel syndrome, they typically will go on prescription medications to help them with their symptoms. But what if there was something in your diet that was actually the trigger for your symptoms? Wouldn't that be great to figure that out? Well, that's what they did at Monash University, and they found that when patients went on a low FODMAP diet, 3 out of 4 patients actually had relief of their irritable bowel syndrome symptoms. So let's go over it. FODMAP stands for fermentable oligo-di-monosaccharides and polyols. These are a group of sugars in carbohydrates coming from fruits, vegetables, beans, legumes, grains, and sugars that actually cause fermentation, cause bloating, and cause these symptoms of IBS. And when they eliminated these food groups from the patient's diet for 3 to 8 weeks, patients had improvements, and then they were able to slowly reintroduce these foods back into their diet plan. How cool is that? Okay, so I break this down into 5 major groups of food. First is fructose. So fructose comes from high fructose corn syrup, but it also comes from fruits and vegetables. So things like apples and watermelon and mangoes. There's a whole list of fruits that you might have to eliminate in the elimination phase, and I'll list below in the comment section a map of that. Also know you can download an app from Monash University where you can then quick on the fly see whether a food is actually on the low FODMAP diet. Okay, so fructose, high fructose corn syrup, fruits and vegetables. Second is lactose, so milk products, milk that comes from cows, goats, sheep. You've got cheese, soft cheeses, you've got yogurt and ice cream that goes off the list. Third, there are these fructans, which are again fruits and vegetables that have highly fermentable products in them. Galactans, which are things like beans and legumes, nuts like cashews and pistachios. You have grains like wheat, rye, and barley that you might have to eliminate in the elimination phase. And lastly, you have polyols, which are sugars that are highly fermentable, like sorbitol, mannitol, xylitol. These are artificial sweeteners. You might be getting them in bars and replacement products. So be careful if you are trying to go on the FODMAP plan to eliminate these in the elimination phase. Okay, there's also a group of fruits and vegetables that are acceptable. So don't feel like you can't have the fiber needed in your diet. It just means that for a short period of time, you need to switch over from these high FODMAP foods to low FODMAP foods, okay? And after you eliminate them, if your symptoms are much better, then work with the provider to slowly reintroduce one of these groups at a time. You might decide to put milk back in, or you might decide to put grains back in, or beans or legumes back in, or onions and garlic back in, or you might decide to put certain fruits that are pitted back in. And if you find that the symptoms come back, then you might need to then readjust your diet to take back control of your own health. So part of these elimination plans is to try to identify potential triggers, but know that patients who suffer from irritable bowel syndrome don't just have problems with certain foods. You might have to go in and get a proper checkup with a gastroenterologist, get a colonoscopy, make sure nothing else is going on, do some lab tests, maybe to check for gluten sensitivity or celiac disease or food sensitivities or food allergies, look at the gut microbiome. These other factors, even infections like H. pylori, can play a role in your symptoms. And once you've done everything and you've looked at your diet, then maybe consider a FODMAP elimination with a healthcare provider. I hope this was helpful. Share with anyone who can benefit. I'm Dr. Jyoti Patel. See you until next time.